Hello, I'm going to present our case for the differential diagnosis assignment, the group assignment. We're group 6. We were supposed to come up with a diagnosis for 59-year-old male with complaining of headache. So I will go ahead and present our case. So we have a 59-year-old Caucasian male presenting to the clinic complaining of daily headaches. Started about a month ago. He says that they have gradually gotten worse, and he chose to come in today because he noticed on his right temple a prominent blood vessel that hurt him to touch. So that triggered him to make the appointment today. States he has had persistent headaches for the last month. Throughout the day, the headaches do not cause him to miss sleep, do not awaken him in the night. He describes the headaches as pulsating and more annoying than anything. Doesn't really affect his daily life activities. He has tried Tylenol and Advil, but has found no relief from the over-the-counter medications such as those. He denies any recent trauma, any history of headaches or migraines. He denies any eye pain, changes in vision or weight loss. He also denies any history of stroke. Review of systems is relatively normal. He denies any fever, fatigue, weakness, chest pain, or shortness of breath. No loss of consciousness, numbness, or tingling. He does state that he did have a URI about 2 months ago that resolved on its own with systematic treatment. He is positive for a history of hypertension. He says it's been well controlled with lisinopril 20 milligrams over the last 10 years. His blood pressure today was 122/78, so it does appear well controlled. He does have a history as well of hip and shoulder pain that he says comes and goes, and states that the hip pain has been worse over the last month. He says he has some trouble putting on his pants in the morning. Social history is pertinent. He has a 22 pack year history. Tobacco smoker with occasional marijuana usage. He says about 2 to 3 times per month. He's a retired Olympic skier from Sweden, so he is relatively active still, exercising. His family history is only really concerning for his father, who had CAD and 2 MIs and died at the age of 62. No drug allergies that he's aware of. So with physical exam, vitals were all within normal limits. His blood pressure was good. He's alert and oriented, well-nourished, well-developed male. He appears to state his age. Upon examination of his head, there is prominent right temporal artery that is tender to touch. Scalp is also tender to palpation as well. Otherwise normal, cephalic, and atraumatic, no scarring or lesions on his head. Visual acuity was 20 out of 20 with corrective lenses bilaterally. Conjunctiva were clear, sclera is non-icteric. Fundoscopic exam revealed pallor and edema of the optic disc bilaterally. No AV nicking or cotton wool or hemorrhages found. Cardiovascular exam pertinent for slightly diminished pulses on the right side, specifically his right arm. Otherwise, they were 2+ on the left side. No heaves, lifts, thrills, murmurs, rubs, or gallops upon auscultation. Cap refill was less than 3 seconds throughout. No signs of respiratory distress. Clear to auscultation in all 4 fields. MSK exam showed active flexion at the hips was possible, but limited to 45 degrees. Active flexion at his hips was limited to 45 degrees, and he was unable to perform active extension due to pain. He also showed some difficulty raising from the chair during exam. Normal gait walking around the exam room, and normal appearing muscle tone. Muscle strength was 5 out of 5 throughout, bilateral upper and lower extremities. No pain palpated along the spine. Joints were non-tender. No edema. or redness. Neuro exam, cranial nerves 2 through 12 were intact, no evidence of tremor. Sensation to light touch, pinprick, position, temperature, and vibration were also intact. Excuse me. Cerebellar testing as well was intact. So we did draw some labs. We did a CBC, CMP, ESR, and CRP. Labs in the office drawn showed elevated ESR and CRP. ESR was 100, CRP was 60. H&H was slightly low at about 12 on his hemoglobin and 36 on his crit. Alk Phos is 130, and albumin was 1.5. So his Alk Phos is elevated and albumin is low. All other labs, including the electrolytes, were all within normal limits. At this point, I'm kind of concerned for polymyalgia rheumatica and giant cell arteritis. I would like to do a temporal artery biopsy in the office and would like to get him started on corticosteroids, specifically prednisone, 40 milligrams, initiate treatment of that immediately, and refer him to rheumatology for workup. So that is our case. Thank you.